Good morning. My name is Dr. Greg Vina. I'm board certified specialist in physical medicine and rehabilitation medicine. I'm a certified life care planner and a attorney with a personal injury practice in California. I'm here to talk about associated injuries and spinal cord injury and what effect they could have in terms of your acute rehabilitation and what long-lasting effects they could have in terms of your care and function going forward. I discussed this earlier, that associated injuries are very common in spinal cord injury because most likely in the younger population they're a result of a penetrating injury such as a gunshot, high velocity injuries such as a motor vehicle accident or a high velocity fall, and rarely they'll be just isolated. Again, in the elderly population there are some medical conditions that can cause quadriplegia or paraplegia from just a simple fall because the spine is more brittle. Conditions such as acquired spinal stenosis in an elderly patient can cause this, as well as ankylosing spondylitis, which causes the spine to be very brittle and bamboo-like. But for the most part, it's in a younger population, it's a high velocity injury, and there'll be associated injuries, long bone fractures, hip, upper extremity fractures, shoulder injuries, dislocated shoulders, pulmonary contusions, respiratory failure, interabdominal problems related to the high velocity fall, the high velocity accident, and of course brain injuries. A study by Shepherd Rehabilitation Facility in Atlanta, one of the best facilities out there, they found that 60% of all of their acute spinal cord injured patients had evidence of a brain injury. This is very important. Every patient with a spinal cord injury should be screened for a TBI because the TBI will impair learning, attention, concentration. These patients could appear to be agitated, depressed, interfere with social interactions, and we need to know associated injuries so we can plan appropriate treatment going forward. Other problems, hip fractures, they should be fixed very quickly during their acute care stay to allow for early mobilization, be able to get them out of bed. Early on, when you had a patient with a complete spinal cord injury, these patients were often just placed in a TLSO brace and to see if it would heal over time and stabilize. It's very hard to mobilize a person with a TLSO brace for an extended period of time. This instability could cause long, debilitating pain. Patients should have early fusion, decompression, and fusion so we could get these patients out of bed. But anyways, again, we're talking about associated injuries, and one thing that bothers me is when I hear an insurance company, a payer source, say a patient is not ready for acute rehabilitation because of these associated injuries. They say the patient's had a hip fracture, won't be able to get out of bed, they've sustained an upper extremity fracture, will not be able to use their arms, so they want to send the patient to a skilled nursing facility, a lesser level of care. That just means they don't want to pay as much. Okay. If you've sustained a spinal cord injury, you deserve to go to acute rehabilitation. Even if you can't quite get 3 hours of therapy a day, there are things that can be done: education, range of motion, sitting tolerance, over time, cognitive evaluation, and we can build you up to the 3 hours of therapy that you'll need to get independent. The complications occur when you go to a skilled nursing facility because simply they don't have the know-how, the skill, the physician coverage to provide adequate oversight to prevent complications. If you've had an acute spinal cord injury with associated injuries, you should insist, might be a better word, that you want to go to an acute a center of excellence such as TIER in Houston, Craig in Denver, RIC in Chicago, Shepherd, one of the centers that can provide all the services that you need going forward to become as independent as possible during your acute stay. I feel absolutely very strongly about that. I'm also a life care planner, and what does a life care planner do? A life care planner plans future needs, medical needs, educational needs, vocational needs, psychological needs going forward. A life care planner understands how many electric wheelchairs you'll need, how many battery packs you'll need, how many Hoyer lifts you'll need if you're a high-level quad. We also are trained in terms of understanding what a spinal cord injury will, how a spinal cord injury will affect your independence as you get older, aging with a disability. I have a patient upstairs right now, 17 years out from a spinal cord injury. On the day his shoulders wore out, he couldn't do his pressure release, didn't have the adequate wheelchair, and broke down on his butt and developed his first decubitus ulcer. You know, all these issues, if they're thought about early, planned for, provided to the family, that family would be aware, hey, his shoulders are breaking down, he needs his electric wheelchair that's in the plan. It's already been paid for. Let's get a tilt and space wheelchair so we could prevent that complication. He's been in the hospital for 2.5 months. We fixed his backside. He's going to do a sitting program. He's getting his tilt and space wheelchair. He's going to be discharged, but that's 3 months of his life, you know, that has just been miserable, and it's preventable. A life care planner will plan the future care and needs that a patient will have. A life care planner will look at all the injuries that patient sustained as a result of that traumatic injury. It might be just a shoulder dislocation that was managed conservatively. The patient did relatively well, has a little bit of pain. That's significant. That patient's going to have a potential need for a scope down the road. He's going to need physical therapy down the road. He's going to need more assistive devices down the road. And as he gets older, he might be 75, 80 years old. He's going to need more assistance at home because he's not going to be able to do his transfers because of these associated injuries. As a life care planner, we look into these issues. And they, doctors, I've been practicing medicine for 15 to 20 years now, and the way doctors think is that we take care of the problem and we plan for laboratory tests, and we take care of the problem when they're in front of you. We prescribe therapy as necessary, medications, refer the patient to specialists as needed, but we don't really look 10 to 15 years down the road. That's the job of a life care planner, and I do that also. And we need to think about all the associated injuries that will affect that patient's life the rest of their life. But anyways, I just wanted to briefly talk about associated injuries, the need to get to a center of excellence, not to get diverted to a lower level of care because of these associated injuries, and get to where you need to be, and that is a center of excellence. You have a good day.